See, I've been in the health industry for more than 25 years. So all these years, I'm a neurosurgeon. So definitely what happens is, in my field, we see lots of hardships, accidents, brain tumors, vessel ruptures, and so many very devastating conditions. And over the years, what we observe is there are so many things which we learn, which is not in the textbook. We learn through experience. And that is one of them I would like to share with you. That's one of the thing which is always in my mind. So that is the topic for today. That is health awareness making us sick? The backfire effect of over medicalization. So this is my topic today. So I would like to start today with a story about an engineer, a 32-year engineer. It's a real life incident. He was very successful, very healthy, always fit, and he was a non-smoker. As part of his routine, hope my voice is not echoing too much. Is my voice echoing too much? Hello? It's okay? Okay, thank you. So as part of his routine health checkup, he went for the preventive comprehensive healthcare checkup in one of the major labs in the city. They did an extensive study. He did his blood tests. He did his made his scans. He did the genetic study also. And at the end, they commented a small incidentaloma in the right lung to be evaluated. This sentence changed him completely. He suddenly became very panicky. He started communicating more and more with Google, ChatGPT, suddenly getting in the middle of the night at 2 a.m., asking ChatGPT, what is insulintoma, what is my lifespan, what can I do? All those questions. He started talking to his insurance agents. Mentally he started rehearsing how to break this news to his family, his parents, his spouse. And as part of the further investigation, he went to a major hospital, major multi-specialty hospital. They worked him extensively, including a needle biopsy. And at the end, they declared him, it's only a insulintoma. It is seen in so many patients. It is nothing to be done. You are perfectly okay. He again went to another super specialty hospital. They did the same thing, and they gave the report. It's only a small incidentaloma. It is very common and nothing to be done. He was declared perfectly fit, but he never came back to normal. He had a sudden gush of anxiety. His thought process completely changed. Is something really wrong with me? He kept on thinking and thinking. So with this, I would like to put forth a question. Are we becoming patients even before we are actually sick? So that is the paradox of medical awareness. So I would like to explain on this. That is, medical awareness. Everyone, nowadays medical knowledge is available everywhere. Medical gadgets, you can know your health just a press of the watch or something, or just very easily you can you can know your heart rate, you can know your pulse rate, you can know your saturation, you can know your blood glucose level, everything. With your smartwatches, you can easily, so use your Android phones or a smartwatch, you can easily identify all these things. Even you can assess your ECG, and with the help of artificial intelligence, they will give the report of ECG, that is called cardiac status. So what happens is these gadgets are very sensitive. So what happens, even normal minor things, minor operations will be picked up and labeled as abnormal, even though he is clinically absolutely fine. So when you check the reports, even while watching films, you can just check your blood reports or check your basic reports, and there will be some normal aberrations will be labeled as abnormal, and you will be clinically labeled as high risk people. So this is what happens. Medical science has evolved over the years. It has saved billions of people. Vaccinations have saved so many people. Early cancer detection has helped to detect cancer early and have treated so many people. So many things, like accidents have been treated, hypertension, diabetes, so many. Health has created a lot of revolution, saved so many people. But what happens is, When you shift your focus from, of your health focus from vigilance to over-vigilance, your mindset also changes. That is, your mindset changes from I am healthy or I am okay to is something really wrong with me? Is something really wrong with me? Am I going to survive? Is something going to happen to me? This is how the mindset changes. So I would like to explain this scientifically with the scientific law, the scientific principle based on the, this placebo effect. There is another effect known as the nocebo effect. Hope you have heard of it. You know what is the placebo effect? That is, when you have a disease, you prescribe some medicine, usually there will be some effect. But in the same people, if you prescribe some other people with the same disease, for example, muscle pain, headache, if you prescribe an inert material, it may not be the medicine, still your mind will start, your mind physiology will change, and that will produce the positive effects equivalent to the drug or near equivalent drug. This is known as the placebo effect. Similarly, it's known as under his twin brother, or twin dark side, or twin on the darker side is known as the nocebo effect. What he says is that if your mind expects something is going to harm, if your mind expects that something is going to harm you, that harm will invariably occur in majority of people, at least in 70% of people. This is known as the nocebo effect. So if you expect something is going to harm you, invariably that will happen. And this phenomenon has been studied extensively in various researchers and has been published extensively, including world famous journals like The Lancet and JAMA. This is very commonly seen, especially with side effects. As a doctors, legally we are supposed to explain all the side effects of a drug. But personally, as a doctor, I do not give too much explanation about side effects. The problem is, if you explain too much about side effects, for example, you have got a sinusitis, you have been prescribed antibiotics, you will say, when you take the antibiotic, you might get some gastritis, bloating, some abdominal pain, a little bit diarrhea, something is all possible, or nausea, all is possible. If you tell that and send the patient, invariably he will develop that side effects. This is nocebo effect. Or in other words, if you, for example, you have a person who commits cholesterol, there are the common drugs given to cholesterol is known as statins, atorvastatin, rosuvastatin, so many drugs are there. One of the very usually common side effects of statins is muscle pain. So a patient comes to you with cholesterol, hypercholesterolemia, you prescribe placebo, you know the placebo. It is an inert material, sometimes it might be sugar capsules only. You tell him this is the drug for cholesterol, and there is a possibility that you can get muscle pain. And after 1 week, if you call him and ask, did you develop muscle pain? Yes, he will say, yes, he got muscle pain. This is the nocebo effect. So this is how your mind works. What you feed into your mind, the mind interprets and changes the physiology. Suppose when you take a MRI scan, your spine, your MRI says your spine has got some degenerative changes. Degenerative changes are normally seen in everybody, and you say age-related changes. But if you keep on feeding your mind that because of degenerative changes, you have got a spine has got a spine, certainly you will start acting like a patient. You will shift from being an ordinary or normal person to a abnormal or a patient like psych. So this is basically about this effect. And then another concept is hyperdiagnosis or overdiagnosis. Overdiagnosis is not a wrong diagnosis. It's actually a right diagnosis, but a seemingly normal thing is always perceived as abnormal. That is overdiagnosis. And one famous neuroscientist, Mr. Gilbert Walsh, has extensively written about the harmful effects of overdiagnosis, and he has published extensively. I would like to quote an example. For example, when you take, with the modern medical imaging system, for example, an MRI, with the advanced MRI, if you subject one person to MRIs, if you subject yourself to MRI, almost every one of you, there will be some sort of abnormalities will be detected. For example, I have got a small swelling here. It is a lipoma. It is only a fat globule. It is known as a lipoma. Lipo means fat and oma means tumor. So it's a small fat globule. And most of you will be having such things. But when you subject yourself to a MRI, definitely all this will be picked up. Just like the engineer story, it is small lipoma detected, needs further evaluation. That is the only way MRI can be interpreted. Similarly, when you go for a thyroid checkup, when your thyroid gland, at least in 60% of people, there will be small nodules or small cyst-like lesions. And they will report that it needs further evaluation. So what happens is, if you keep on overdiagnosing, or means if you seemingly benign lesions, if you always try to think of it as abnormal, what happens is your focus keeps shifting, just like the engineer's strike changed. And what happens there is a phenomenon known as the worrying well. Just like a frog in the well, there is another new thing which is emerging, worrying well. Very highly educated, highly prolific people, due to their over-exposure to information and over-exposure to technology, what happens is they start keeping worrying and always subject themselves to so many self-harm, that is anxiety, depression, all those things. This is known as the worrying well. So that is the psychological cost we have to pay for all this over health awareness. So what happens to us? Slowly, we start losing faith in our own body. We stop trusting our own body. The normal changes which usually occurs in our body, for example, after a hard day's work, you may have some muscle catch. Like you may feel some pain in the left side or shoulder of left chest. Suddenly what you think, oh my God, I got heart attack. I have to avoid it. Immediately, he goes in that direction. You may be tired after a day's work, and when you're sitting tiredly, you will start thinking, I have got hormone imbalance, I am always tired. So you will go in that direction. Or sometimes we may have bad experience in your office. Maybe you have your professional, some problems might have occurred, or you have had a bad experience with your boss or your colleagues, something might happen. You may go into a trance in depression or sadness. And when you overthink about it, I am in depression. My neurotransmitters are not working properly. I have to avoid it. So this is what happens. You stop trusting your body. And everything, what happens is, whatever you feed your mind, your body will respond accordingly and the physiology will change accordingly. If you take MRI and the MRI says that there are multiple degenerative changes, different level of small discs are there, and you start labeling yourself as a spine patient, automatically your body and mind will change according to, just like a spine patient. Similarly, you are pre-diabetic. You are going to be, if you don't take care, the doctor might say you are pre-diabetic. If you don't take care, you might become a diabetic later. What happens? Immediately his psyche changes. He started acting like a diabetic patient, and invariably he becomes a diabetic. Similarly, hypertension, if they say you have got hypertension risk, same thing happens. So this is the psychological cost we have to pay. And another thing is the social media, bombarded with social media and the optimization trap. For example, I would like to quote the examples. Suppose when you sit for a long time, there will be a small swelling in your ankle. You immediately start checking, what is this? And Google will tell you, swelling in the ankle can be a sign of early kidney failure, or it can be a sign of diffuse inflammation. What happens? He started all sort of gimmicks. Usually these are all seen common in people. You just take some rest or you just walk out, that swelling will go. But this is how people's mind change. Similarly, what are the food habits that can make you stay away from hospital, or what are food habits that give you long life? And they start Googling all sort of bizarre things, and what happens is they are bombarded with so many information. They design their food habits in such a way that in the breakfast there will be so much of different things, and they will be excluding so many of the very common things we eat. They will say, I have excluded 20 types of toxins. This is my carbohydrate, this is my fat, this is my this. So what happens is that he is not cherishing the real essence of food. He is so not only his own life, his entire family's life. His mother is forced to make a very difficult breakfast just to satisfy his Google-based information. And you keep on optimizing yourself based on this. This is not the optimization trap. One thing which you should always understand is that our human body is extremely robust and resilient. Nature has created it in such a way that so many insults, I don't say that every insult, but mild to moderate level of insults, our body has the resilience to withstand it and cure it and maintain our body status. So, at this stage, what are we supposed to do? Is ignorance the answer? Never. People always say ignorance is bliss. Actually, it is rubbish. If you're ignorant, you're a fool. That's all. Ignorance is not the answer. You have to accept the phenomenon of intelligent restraint. That is, you should understand what all is right and what all is wrong. That intelligence you should have. So for that, you should have appropriate or proportionate medical awareness. You have to differentiate between relative risk and high risk. What is relative risk? What is high risk? Suppose you buy a car, and after the sales people will be telling you so many different things and all this protective gadgets. You tell him and you ask him, is there a chance that this car can have an accident? Definitely he will say, yes, there is a small chance for accident still. You have to be careful. That is a relative risk. But if you start thinking that, oh my God, I'm going to have an accident again, and every time you start to drive, that is absolute risk. You keep on inviting that, and finally it will happen. So that is, you have to differentiate between relative risk and absolute risk. That is, when a medical professional explains to you about relative risk, don't automatically make it an absolute risk. And next thing is, always understand the context before jumping into conclusion. This is what happens to that engineering graduate. What happened was, he got a lot of information, but he didn't understand the context, and he jumped into unwanted conclusions. The next thing we should always understand is that our human body has been created by nature to be extremely resilient and robust. So we have to trust our own body. A great degree of insults can be handled by your body alone. And also understand that we have to optimize our medicalization. Just because we have access to all these medical gadgets, because you have free checkups by your company, everything, doesn't mean that you should subject yourself to frequent medical checkups. If you're really healthy, just once in a year checkups is enough. So I like to conclude to what I'm trying to say is that medical science or modern medicine is not created to make you perfect. It's only a tool, it's only a branch of science which is aimed to make your life better. That's the only aim.